Maybe you've heard of Ebola before, but what about the Bundibugyo strain? Well, that's what Congolese health officials in eastern DRC have been battling to contain as hundreds of cases are confirmed. It's a rare variant of the virus that doesn't have a licensed vaccine. Are they winning the fight a month after the outbreak was officially declared? Let's take a closer look at how the current Ebola outbreak has spread. The first known case is a health worker who dies in Bunia, the capital of Ituri province, on April 24th and is transported to the mining hub of Bundibugyo. Initial field test for the common Zaire Ebola strain returned negative. 3 weeks later, an infected Congolese national traveled 700 kilometers from Ituri to Kampala in Uganda. He later dies at a private hospital. A day later, on May 15th, the DRC Ministry of Health officially declares an Ebola outbreak after the National Institute of Biomedical Research isolates the rare Bundibugyo virus. On May 17th, the World Health Organization issues its highest global health alert, declaring the Ebola outbreak a public health emergency of international concern. The United States says it will stop non-U.S. citizens who have visited the DRC, Uganda or South Sudan within the past 21 days from entering their country. As the virus spreads to South Kivu province, Uganda isolates a second unrelated cross-border case, prompting Kampala to issue a 4-week suspension on all cross-border public passenger buses, commercial flights and ferries arriving from the DRC from May 21st. The DRC Ministry of Transport suspends all commercial flights into and out of Bunia Airport, except for humanitarian flights to curb the spread of Ebola. On June 5th, the WHO and Africa CDC launched a continental response plan that aims to raise $518 million to support African countries prepare for, rapidly detect and respond to the current Ebola outbreak. But health officials are dealing with the fallout of severe global aid cuts that would usually fund an Ebola outbreak emergency response. It's been further complicated by an active armed conflict in eastern DRC, disinformation, community distrust that has led to the burning of some treatment centers and lack of well-equipped hospitals. Despite having a handful of cases, Uganda's tourism ministry has faced a wave of cancellations, and travel bans have stopped cross-border informal trade.
When they closed the border, we were told that trucks would continue operating, so we ordered for plantain from DRC. They brought them and offloaded across the border, and when we tried crossing, they blocked us. All our goods are now there rotting.
Now, even though Kenya has never recorded any Ebola cases, 3 protesters have already been killed over a US-funded 50-bed quarantine facility that's being set up at the Laikipia Air Base in central part of the country, despite a court order.
We do not want to import Ebola to Kenya. We do not want to import it to Nanyuki. The people are saying no. The county government has said no. The Chamber of Commerce has said no. People's representatives said no. The courts have stopped the facility. But it looks like this government is going to go ahead and build it by any means necessary. They are going against court orders, and that's why we, the people of Nanyuki, are saying, no, we have to come out and protest and say, come on, why does the Cabinet Secretary of Health have to say that he doesn't care for the opinions of our people?
We cannot and will not allow any cases of Ebola to enter the United States.
When President Trump asked the government of Kenya to support them by having a center in Laikipia Air Base, I gave the okay because it was an agreement and a partnership with friends who have worked with Kenya for 30, 40 years.
Now, it's the 17th Ebola outbreak in the DRC, and medics say they're overwhelmed by the influx of hundreds of patients as well as limited supplies. But there is hope, as about a dozen patients have already made a full recovery. Prosper Herring Gorora spoke to a survivor from Bunia.
Furati Kamanyire feels lucky to be alive. The 30-year-old mother of two is one of dozens who has survived a deadly strain of the feared Ebola virus.
I felt severe pain and intense fatigue. I experienced a fever of about 40 degrees Celsius. That's when they started treating what they thought was malaria. When I finished the anti-malarial treatment, my body continued to hurt as if nothing had been done.
Furaha says she was infected last April before the epidemic was officially declared by the Congolese authorities, and she was treated according to symptoms she presented. 3 provinces in the east of the country, including Ituri, North and South Kivu, have been hit by Bundibugyo Ebola. International partners say there is more to it than the critical medical response.
There is a lot of mistrust around, there's a lot of rumors and misinformation that is circulating. People are afraid, but that is also why it's critically important to be working with people who are trusted in the community, people like faith leaders and other community leaders who are able to share key prevention messages.
Here in Goma, the only confirmed case of Ebola has been declared cured and discharged by local authorities.
My hope is that recovery cases continue. We are being helped so that we don't die from Ebola. Those who have recovered are already true testimony for the rest of us.
Leaders of the M23 group, which controls the city of Goma, say they've received a significant shipment of medication from technical partners to administer to confirmed cases and high-risk contacts.
500 doses of remdesivir, a drug recommended by the World Health Organization, are available to initiate treatment for Ebola virus disease in Goma and Bukavu.
No standard treatment is available against the Ebola Bundibugyo strain, and experts believe that preventive measures are the only way to help limit contamination. Prosper Heringurora, Africa Matters, Goma.
So let's hear more from Dr. Patrick Otim. He's the Program Area Manager for Emergency Response for the World Health Organization African Region. He joins me from Brazzaville in the Republic of the Congo. Thank you very much, Dr. Patrick, for making the time. I mean, just straight up, what's your overall analysis of the Ebola response efforts so far, particularly in the DRC and Uganda?
We have 3 provinces affected in the DRC. The outbreak is largely localized within the Ituri province, where almost 94% of the cases are coming from. And therefore, the efforts have been ongoing to try to scale up the response in Ituri to cover all the 18 health zones that are affected within Ituri province. Now, when you look across the border in Uganda, the outbreak there is quite localized. So we have 19 cases reported. Out of these 19, 14 are actually linked to cross-border transmission. So these are people who travel from DRC to seek healthcare in Uganda. And so far in Uganda, over half of the contacts, so 300 contacts that are being followed up, have already finished their 21-day follow-up, so they remain with another 300 that they're following. So the rest, the outbreak in Uganda is quite localized and well-defined. The epidemiological chain has been clearly described, and therefore we believe that that is fairly under control.
We also have the Africa CDC and the WHO launched the One Plan, One Team, One Budget framework. It is working at the very least, right?
Yes, at the moment, the response is working because all the cases that have been reported in Uganda have been epidemiologically linked. The 5 local cases that have been identified have all been contacts that were already known and they were being followed up. So far it has been 5 days. Today will be 6 days without any new case being confirmed in the country. So we believe that if we continue in this trajectory, we will be able to have this situation in Uganda under control. However, as long as we still have this huge outbreak happening in DRC, the risk then to the country remains. And that's why the focus is to try to stop the transmission at the epicenter in Ituri and try to really scale up across all the pillars of the response. And the plan that you mentioned is a joint plan that we've worked on with Africa CDC and all other partners to try to mobilize the resources that are required to mass really the interventions across all the pillars. Because as you know, Ebola response is quite complex, is quite resource intensive, and we therefore need to be able to deploy quickly to contain the spread.
Right. So this Bundibugyo strain, and let's stick to the DRC for this one, what's made this outbreak particularly challenging, and have the countries overcome them? Of course, we're talking about DRC, Uganda mainly, and many others.
You have the Bundibugyo species, for which there is no known vaccine, no approved vaccine available, and there's also no approved therapeutic. So that presents a challenge that you cannot quickly vaccinate like we used to do for the Ebola Zaire, the contacts and their contacts, and try to circle in the transmission to stop it there. So you need to go with the traditional public health measures. So that is the first challenge. The second challenge is the context within which the outbreak is occurring. So the Ituri is a province that has significant security constraints, there are access constraints, there are displaced populations, there is a high population movement because also of the mining activity in that area, and that presents a challenge because then it favors the transmission of the virus. And then lastly is also the fact that this outbreak was detected late. The fact that it was detected late and the fact that the disease presents similar to common malaria or other tropical diseases like typhoid, it was already moving in the community for almost 4 to 6 weeks before it was identified. And coupled with the high population mobility, it enabled the virus to move far and wide within the Ituri province. And that is the fact that we are trying to get ahead of now, trying to establish a full package of response in all the health zones where cases have been confirmed, but also scaling up surveillance in the neighboring health zones where no case has been confirmed yet.
We need to talk about Kenya because we've seen protests, 3 people killed, against the establishment of a U.S. Ebola quarantine facility in the country. This is a country that has never recorded any cases of Ebola. What's the risk of a new Ebola outbreak in the country with all these factors in mind?
So as WHO, we've done a risk assessment and categorization of countries within the region. Now that is based on the population mobility patterns, that is based on commerce and the social linkages between the communities, because a number of the communities, cross-border communities, are linked. So Kenya is categorized in category 2. That means that the risk for spread is there because Kenya also has a huge population doing business in the DRC. Now, when that risk is there, we advise countries to be able to implement a package of readiness measures so that when there's an imported case, they're able to detect quickly and isolate and manage that case. Now, setting up isolation and treatment center is one of the things that each country, there are 10 priority countries neighboring DRC that they need to be able to put in place. Now, also countries may be able to receive contacts because although we discourage contacts from moving, but somebody who has been a contact may end up in one of the countries. Now, quarantine is one of the public health measures for managing contacts. That means that you restrict the movement of the person so that they cannot come close to other people. Now, quarantine is for contacts, it's not for sick people. Sick people, we put them in isolation and we manage them. Quarantine is for people who have not developed symptoms, but they have been in contact with a confirmed Ebola case. For us, we do recommend that if the quarantine is to be implemented, it has to be risk-based. It has to respect the human rights of the people and ensure that it is in a way that facilitates rapid access to care if that person has developed any symptoms. Now, the decision on how to implement this is largely a responsibility of the countries because countries are sovereign, but there are basic public health measures that we advise, and we are glad that most of the countries have been taking these measures and implementing them as per the recommendations.
All right. Dr. Patrick Otim there, the Program Area Manager, Emergency Response for the World Health Organization African Region. Thank you very much, sir, for your time and for such valuable contribution.
Thank you.
Beyond the World Cup, the U.S. has made it a lot harder for Africans to visit their country. That's because the U.S. plans to cut the number of embassies and consulates across Africa from nearly 50 to just 20. This means some students, tourists and business people will have to travel to another country just to apply for a visa. Victoria Amunga reports from Nairobi.
It was a dream come true for Sudanese filmmaker Rawia Al-Haj when in January last year, she traveled to the United States to showcase her art, but it wasn't easy. Al-Haj was forced to move to Kenya's capital, Nairobi, where she spent weeks navigating a demanding visa process.
When I want to get visa, they ask for many things. I have many things like residence, a bill for rent, and for work, for my salary, for everything.
She was one of the lucky ones. This is Eslam Koko. She's hoping to join her husband who's already in America, but she's been stuck in visa limbo in Nairobi for 5 months now, miles away from her home in Sudan.
I didn't know what I was going to do for 5 or 6 months. I didn't know where to go exactly. I didn't know where to hand over papers.
For millions of Africans, access to the United States is about to become even trickier. Washington is restructuring its diplomatic footprint in Africa, resulting in a dramatic reduction in the number of embassies and consulates offering visa processing from 50, almost one in every country, to just 20 in a continent with 1.5 billion people. As governments continue to debate immigration, security and diplomacy, it is the ordinary Africans who are likely to bear the greatest burden as the new policy translates into higher costs and additional hurdles. U.S. visa applicants from Africa have already been affected by a travel ban on certain countries, as well as a $15,000 bond requirement. Reports suggest that consular sections in non-hub countries will stay open to assist U.S. citizens with passport renewals and emergency consular requests and host community hubs like this one, where students can access American libraries and teachers remotely.
We have 6 pillars, and so those 6 pillars are focused on accurate information about the United States, strategic cultural programming, English language learning, as well as Education USA, how to study abroad, and professional skills building.
It's not clear when the changes come into effect, but it's expected in June. For Eslam and others like her, the burden of extra journeys and missed opportunities continue. Victoria Amunga, Africa Matters, Nairobi, Kenya.
Nigerians living in South Africa say anti-foreigner groups gave undocumented migrants a June 30th deadline to leave. Nigeria's diplomatic mission in South Africa says more than 1,000 people have registered to return back home. Akin Alaka was there when they landed in Lagos.
No more kwara kwara. No more.
For many, this is the first time they have been on Nigerian soil in a decade. Most carry just one bag, some with children.
Even the officer now, they say June 30, we are going to kill you, we are going to do that. We are not safe in this country. We don't have freedom to walk on the streets.
Emilia sold food on the streets of South Africa for years. She says police seized her stock. Her daughter was taunted at school and told to go home. The voluntary evacuation was organized after a spike in demonstrations targeting foreigners. A citizen-led movement calling itself March and March has issued an ultimatum that African migrants must leave by June 30th. Nigeria's government says over 1,000 citizens are registered to return.
The xenophobia has not really affected me, but it did affect my kids in terms of the teachers discriminating my kids and also being so biased towards my kids.
Abuja says it is exploring a response before the deadline, and many Nigerians are watching to see whether South African business interests here will be part of it.
There is pressure on government for us to activate drastic sanctions against them, considering the fact that we have a lot of very successful South African businesses here in Nigeria that are not being molested. They are doing, they are making a lot of money from our economy. We have Nigerians that are doing genuine business in South Africa. They are being frustrated. Now some of them have abandoned their businesses to return to the country. So it's not a good development, but we are considering different options. If the situation escalates, definitely necessary reciprocity will be activated.
For the returnees, the politics can wait. The arithmetic of starting again cannot.
I left everything I have in my house, everything. I just came the full clothes, the 23 kg, they say we must come with, just because I want to go home. I came with empty hand, I don't have anything.
They left South Africa as residents. Now they are leaving this airport as returnees. The paperwork is done. South Africa's president has spoken. Yet the June 30th deadline is counting down. But for these families, the hard part is finding work, housing, and a means to start all over again.
The journey from Johannesburg took 6 hours, but rebuilding a life would take far longer. Akin Alaka, Africa Matters, Lagos.
And xenophobic attacks in South Africa appear to be having their intended effect, with Malawians also fleeing the country. Malawi received its first group of repatriations this week, with thousands more expected. Lamek Masina reports from Blantyre.
After 5 years working at a salon in South Africa, Mary Jalas is back home. The mother of 2 children says she lost almost everything when a group of South Africans chased her from her home in Western Cape province.
I managed to rescue very few belongings, but still, I'm very grateful because I managed to save my life.
Jalas is among the first 150 Malawians evacuated from South Africa following a recent wave of anti-immigrant violence that has forced hundreds of foreign nationals to flee. Back home, they gathered at Kamuzu Stadium in Blantyre before they transported to their final destinations across the country. Migration has long been a lifeline for many Malawians. Thousands leave for South Africa every year in search of work to escape poverty and limited job opportunities back home.
I left Malawi for South Africa because of poverty. I was even failing to feed my family. That's why I decided to look for a job elsewhere.
South Africa has experienced recurring outbreaks of xenophobic violence for nearly 2 decades, fueled by claims that migrants are taking jobs from local people. The latest unrest has displaced hundreds of migrants, with homes and businesses looted and burned. South African President Cyril Ramaphosa has condemned the attacks.
Must make it clear that only the authorized government officials may act against violations of the law, including violations of our immigration laws. No other person is allowed, for example, to confront someone in the street, in the pathways of our country to demand proof of identity.
Malawi government officials have warned the returnees against returning to South Africa.
There are people that come and when after a few minutes or a few days they also return. But according to the situation in South Africa, it's not good, and therefore we are not encouraging them to go back to South Africa, because these are our people. We need their lives. We need their support. We need them to develop the country.
Nigeria, Ghana, and Mozambique have already repatriated hundreds of citizens. Malawian authorities say more than 3,000 Malawians are expected to return home in the coming weeks. Lamek Masina, Africa Matters, Kamuzu Stadium, Blantyre, Malawi.
That's our show this week. Let us know what you think about the response to the Ebola outbreak and the U.S. Ebola quarantine facility in Kenya, or comment on any other stories you've seen on our Africa Matters YouTube page or on X. Thanks for watching, and it's goodbye from me, Grace Kuria Kanja.